They're not only getting a new organ, but I mean, it's changing their entire world. So just to be that caring voice and being there with them, that's just what keeps me going. My name is Bayli Segar. I'm a registered nurse here at Houston Methodist. I work on Dunford West, which is a multi-organ transplant unit. Today, I have a nursing student following me. I will be educating him on our unit and just giving care to patients that we take care of. Because morning time, I mean, it's just a lot. Like, as you see, there's people in and out of the room, there's doctors, there's physical therapy, speech, and they're like, I don't even know who is in here today. It's so much for a person and their family to go through. It's overwhelming. Transplant patients are very resilient. You watch them go through, as their nurse, many different obstacles, and they take whatever, life throws at them and they continue on, because that's how precious getting a second chance at life is to them. Nursing is no easy task. And no matter how hard we work, how busy we are, how underslept we are, going home at the end of the day and knowing that I have changed someone's life in a positive way makes it all worthwhile. A typical day on the multi-organ transplant unit starts with getting reports from the night shift nurse on my 3 or 4 patients that I will be taking care of for that shift. 416, Miss Annabelle Vela, 62-year-old female. She is a heart from January of this year. She's gonna go for a right heart cath today. I will be giving a unit of platelets. They were 67. After that's complete, I like to go ahead and grab my medications from our medication room. Transplant patients tend to be on a very vigorous, medication regimen. They take a lot of anti-rejection medications. They take a lot of vitamins and supplements as well. So morning med pass is pretty crucial, and I like to be as organized as I can be going into that 8 a.m. medication pass.
Yeah, I know that blood is to be given no longer than 4 hours, but is there a protocol for?
Minimum 1 hour, maximum 4.
And
platelets are pretty quick though, because they're by gravity, and she has a central line,
so it's wide open with gravity.
It's wide open, but we'll probably slow it down just so it's not given too fast.
Okay.
Yeah.
My name is Dustin Elliott. I am a nursing student with WGU, which is Western Governors University. I am in my last semester, so this will be my last set of clinicals. I'll be with Bayli for 15 days. I'm sure it'll be fun, exciting, and I'm going to be learning a lot.
Teaching nursing students or a new graduate nurse who is new to our unit is something that I'm very passionate about. It's teaching a student how to maybe do their full head-to-toe assessment on a patient and, trying to figure out those triggers of, is something going wrong? Is something not right with my patient? Before we walk in the room to take care of Miss Vela for the day, we notice that she has a contact precaution sign on her doorway, which means the patient has a type of infection that, as the care provider, you need to protect yourself for. So as my student and I, we enter the room, we're assessing her, we're giving her morning medications, and we let her know the plan for the day, which includes, having her not eat or drink for the morning for her procedure, and also letting her know that we will be giving her units of blood and if she would consent to this. All right, Miss Vela, we'll be in here for about 15 minutes with you, getting your platelets started. If you start to feel anything from it, just let us know, okay?
Okay.
When the platelets are done, about 2 hours after that, we'll come and redraw your blood counts just to see where they are.
Okay.
One of our patients is a fresh liver transplant patient in Dunford 14, and he got to actually advance his diet today. So that was something that the patient from the get-go this morning, he was like, I want this tube out of my nose, I want the soreness out of my throat. And we said, we're gonna talk to the liver team. So he did pass his swallow study with speech, and the doctors deemed it appropriate for us to remove his nasogastric tube and for him to be able to start taking both food and medication orally through his mouth. So it was very touching just to get that removed for him. And it was also a next step in his care. He was, going to that next phase of care. That was another thing off of the checklist for him.
They're
on high doses of it.
I see. Yeah, a lot of stuff to learn from you. A lot of stuff to learn from you guys.
Yeah.
You can overwhelm me quick, and I feel like I keep up pretty well, but.
I always like to, take a step back and remember that I was once in a student's shoes. Medicine is changing every day. It's just, we all learn from one another.
As a nursing student, you hope to experience as many things as possible and to see as many things and do things. Today I've done wound care, I've done sterile dressing changes, IVs, tube feedings, taking a tube out, and that's just the physical things other than, learning about talking to the physicians and calling dietary and all the other things that went along. So, great first day for me.
I chose nursing because when I was younger, I experienced my grandmother. She was very critically ill, and she spent a couple days in a critical care unit. And I was very young, but the care that the nurses and physicians gave my grandmother, I really absorbed that, and it stuck with me for many years. And I found also the need of helping people was, my passion. Caring for a patient and getting to see them move on and progress to either going home or maybe to inpatient rehab it's one of the best feelings, is getting to see them move on and just complete that goal and just finally leave the hospital.
Can I give you a hug? I'm like,
oh my God,
so close to going home.
I'm so excited for you all. Congratulations. I didn't mean to interrupt. Oh my gosh. It's just such a beautiful feeling. It makes me warm inside just to know that this patient and their family, they're moving on to the next step, and what we have done as their care team has led them to this point. It's definitely one of my favorite things working as a transplant nurse.